you today? My name is Nurse Victoria.
I'm not doing very well.
You're not? What's going on?
Well, I had this sore on my foot. I've had a lot of issues. I'm here and you're going to tell me everything I need to know.
Yeah, I actually called you in today because we actually need to go over some infection prevention measures with you. It is important in maintaining good diabetic foot care because diabetics are at a higher risk for premature death, heart attack, stroke, and amputations if you leave those sores untreated.
You're scaring me, nurse.
I know, it is scary. 25% of people diagnosed with diabetes will develop a foot ulcer due to poor circulation.
Okay, give me good information.
Yeah, that's what we're doing today. With proper treatment and care, we can prevent those outcomes. So the first step in prevention is proper foot care. You need to make sure you have proper fitting shoes, good balanced nutrition, taking medications as prescribed, and performing daily foot checks. During daily foot checks, some things you need to look out for are redness, swelling, discoloration, skin breakdown, painful sores or calluses, and some other signs of infection include uncontrolled high blood sugar, fevers, chills, confusion, and foul-smelling discharge.
That's a lot. What should I do about the sore on my foot? That's my main concern right now.
Are you having any of those things on your foot right now?
Yes.
Do you have a sore?
Yes.
Okay. So the first step is to immediately report it to your provider, which you've done, so good job. You need to stop having that attitude with waiting till tomorrow, because the longer you wait, the worse it can get. The second step is to maintain proper wound care. So whether you're performing that yourself or the nurse is coming to do that, that's very important as well. And you need to remain on your regular antibiotic regimen.
Can I still have my beer every night?
You know, alcohol can negatively impact the effects of antibiotics. It can also lower your immune system and disturb your sleep pattern, which sleep is also important to maintain proper healing on those feet.
Yeah, I haven't been getting very good sleep.
No.
I'm trying to take a bunch of Benadryl.
Yeah, that's not good.
No.
Some things you could try instead are drinking some hot tea, caffeine-free hot tea at night. That might help you sleep. And you should also make sure you're getting enough protein in your diet to keep that foot healing properly.
Okay, so back to the sore on my foot. What are you going to do about it right now?
So some things the nurse will do when taking care of your foot, we'll remove your old dressing, we'll clean and assess the wound, so we'll measure it to see if it's gotten any bigger, we'll clean from the cleanest area to the dirtiest, and we will apply new dressings to your feet.
What can I do about it on my own at home?
Well, some things you can do are maintain proper hygiene and toenail care of your feet, keep your feet dry, avoid soaking them, and keep your feet elevated when you're sitting and watching TV or sitting with family. Keep those feet up in the air, prop them up, and you could also help by wearing properly fitting shoes, so nothing too tight on your feet.
Are these too tight?
Those look good.
Okay. I think I have it.
A little girly for you,
I
Ren,
think I got it covered.
Okay, now that I've given you all this information, can you tell me what you're going to watch out for at home to prevent and control infection in your feet?
From this visit, I have gathered that I need to keep my feet dry, look for any swelling, redness, or call you if I have a fever or notice any changes or anything abnormal. I'm going to keep my feet clean and elevated. I'm going to quit drinking, especially when I'm on antibiotics. I'm going to try to eat more protein, and I will call you right away with any concerns.
Good.
So what are the antibiotics doing anyways?
So your antibiotics are important because they destroy and slow down the growth of bacteria in your body. Because you have a lowered immune system, you can't always fight these types of infections on your own, so the antibiotics help with that. And you need to make sure you complete the full course of the prescribed treatment, because if you don't, there's a higher chance that the bacteria will become resistant to the medication, which means the medication would not work anymore.
That's not good. I don't want that, but I always forget to take my medications.
Okay, so some things you could try at home are you could get one of those. Have you seen those pill boxes?
Yes, I have one. I don't use it.
So start using that. That will help you organize your pills each day and keep it somewhere where you're gonna remember, like by the door before you go out and get the eggs in the morning. That way you see it when you're going out the door and you remember to take your dose.
That's a brilliant idea.
Okay, so do you have any questions for me?
No, I think that's all.
Okay, so we'll see you back in 2 weeks once your antibiotics have had a chance to work. Okay?
Thanks, nurse.
All right, you're welcome.
Are you guys done yet?
This is my son.
Hi.
Hi, my name is John.
Hi, John. Nice to meet you.
Nice
So
to meet
you're
you too.
you're Red's son.
I am.
So we were just talking about. He has a sore on his foot, and we were just talking
Oh.
about some proper techniques because, if these sores get out of control, they can become infected.
Well, he didn't tell me anything about that.
I'm just learning all of this today.
Okay.
So I don't think he was aware quite to the extent of how bad these things can get out of
I
control.
could lose my leg.
And we were just going over some infection prevention measures so that he doesn't lose his foot, because that could be, a long-term outcome if these infections aren't controlled. So we were just discussing some of those things. Are you close by? Do you live close near Red?
Yes, I live nearby.
Okay.
I don't have a lot of time because I'm always working on the farm.
Okay.
But I guess we should take care of this now before it takes more time, like if you lost a leg.
Yeah, because that could be, really a lot more work for everybody, and we don't want that to happen, right?
Right.
Yeah.
So some things we were talking about were, keeping his foot dry, clean. I think we're gonna have a visiting nurse come in to change the dressings on the wound, so that, that's not up to you
Because
to
you won't
do.
take care of me.
But just making sure, if there's any discharge or any changes, fever, anything like that, to call right away so that we can come and reassess the wound. Also,
my wife's a nurse, or she's an LNA.
oh, okay,
So
perfect.
Judy,
So
so I think she could help too, and maybe.
She could help me with the pills because
Right.
the nurse wants me to get a pill box. I mean, I have one, but now I have to actually use it. Take it out of the wrapper.
So the pills are the antibiotics. That's what he's talking about.
Oh,
We need to make
antibiotics.
sure that he's taking those regularly, and also, maintaining his diabetic education stuff, like taking his insulin, checking his blood sugars, keeping the carbs, counting the carbs, all that's good stuff. So if we can have family involved in this, that could be helpful, because I know he can be a little forgetful.
I'll drive you to all your appointments, Dad. Don't worry.
Okay, so do you have any questions for me?
I don't think so. What? No.
No,
I
we
don't
already
think
went
so.
over his drinking, and he needs to
Yeah,
cut
they
back
want
on
me to
the-
quit drinking.
He needs to cut
Well,
back
I buy
on
the
drinking.
beer, so I won't buy
Okay,
that anymore.
perfect, because we were just talking how that can counteract the antibiotics,
Right.
which is
Judy told me about
counterintuitive.
that.
Yeah, we don't want that to happen. So I know lots of life changes.
No more
but-
bacon, no more beer, take pills.
I thought bacon was protein though.
We can have things in moderation, but
Oh,
you
good,
need
you're
to
not
just make
taking
sure
everything
you have,
away.
No, you just need to, get a little bit more organized, I think, and just realize that this will benefit you in the long term, right, for your health.
She's not bad.
No, she's not. She's a very good nurse.
Okay, well, if you guys have any changes or questions, feel free to call me. Just make sure you're not putting things off, because these things are really important and they can spiral out of control very quickly.
Do you
We
hear
don't
that,
want to
John?
end up in the
I do.
hospital.
Okay.
Okay.
I'll be better.
And just be, aware if you're taking long walks through the mall with the grandkids, you really need to be checking those feet. And
Let me sit down.
Yeah, you need to take
You can
breaks.
sit in those massage chairs and get your feet up.
Yeah, exercise is good,
Thanks,
but
John.
you need to make sure you're checking your feet, even if you're not having all the feeling that you think you should be having there.
Great.
Okay.
Well, thank you,
All
nurse.
right. Have a
Thanks
good
to
day,
meet you.
guys. Bye.
Bye.